Hey y'all, it's Dr. Harper. In this video, I'm gonna take the time to talk to you about abnormal Pap smears. I have a special place in my heart for issues that affect women and make them feel ashamed and embarrassed when they shouldn't. And that's exactly how I feel about abnormal Pap smears. They are so common. Every single day in my office, I have to call a patient or two or three and tell her that I've gotten an abnormal Pap smear result for her. And oftentimes the patient on the other end will cry and just feel really sad and ashamed and scared that something really bad is going to happen to her. And so I want to empower all my patients and all of you about actually what is going on to try to reduce that shame and fear. So let me explain what a Pap smear is. So I'm going to use my model here. So this is the uterus, this is the cervix at the bottom of the uterus, and this is the vagina. So babies grow in the uterus and tampons go in the vagina, and the cervix is kind of what separates the two and holds babies in when we're pregnant. So when you go to the doctor and they do a Pap smear, basically the doctor puts a speculum in the vagina to open it up so that they can see, and then they collect some cells from the cervix. Those cells are analyzed, and basically what they tell us is, are they normal, are they at low risk, are they at high risk, or are they cancer? And the vast majority of abnormal Pap smears are at low risk. Now, some will come back at high risk, and very rarely will have a true cervical cancer result on a Pap smear. And so what I want you to know is that it's usually years from the time that you have a low-risk Pap smear to the time that actual cervical cancer could develop. And so what an abnormal Pap smear tells your doctor is when you should follow up. Should you follow up in several years, which is when you might have your next Pap smear if it were normal? Should you follow up in 1 year? Do you need to go ahead and have a little minor surgical procedure to remove those cells? Or do we need to get more aggressive? But it does not mean that you have cancer. It's just telling us how often to follow up and what we should do about it. So the thing that causes abnormal Pap smears is usually a virus called HPV. HPV is everywhere. It is sexually transmitted either through intercourse, through anal sex, or through oral sex, and everybody has it. So by the time that we're 50, over 75% of people will have had HPV. And it is a virus. So just like a cold, most of the time when we get an HPV infection, our immune system functions and just kicks the virus out, and then we're kind of done with it. But every once in a while, the immune system won't function properly, or we'll get a hold of an extra bad strain of HPV, and that can cause the progression from the precancerous cells all the way to cancer. So that's why we do Pap smears, and that's why it's very important to follow up on them. So what we can do to prevent HPV is use condoms and get the HPV vaccination. If we can get all young children vaccinated against HPV, then we can actually reduce the risk of anyone ever developing cervical cancer in their young or older ages. So it's super important. So what I want you to take away from this video is that abnormal Pap smears are really common. Most of the time they mean not really anything significant, just that you need to have more frequent follow-up. They do not mean that you have cancer. They're usually caused by HPV, which doesn't make you a dirty or a bad person because everybody has it. And the best way to prevent it is by using condoms and getting the HPV vaccination.